Good afternoon, everyone. Welcome and thank you for joining us today. Today's webinar, Team-Based Approach to Dysphagia Care, Optimizing Care for Patients Living with Dysphagia, will be presented by Natalie Beechey, Janice Duivestein, and Peter Lamb. I am Erin Bailey, Medical Affairs Manager with Nestle Health Science, and I'm your moderator for today's webinar. The format of today's webinar will be a discussion on how healthcare professionals work together to improve outcomes and enhance the quality of life for patients through a holistic and collaborative approach. At the end of the webinar, there will be time for questions, and you can enter the questions into the Q&A box to the right of your screen. We will also have poll questions throughout the webinar, which you can access also to the right of your screen. Once the recording of the webinar is ready, you'll receive an email that will include a link to the recording and a certificate of attendance. To keep in mind, our discussion today, we're not overriding the regulations set by every college in every province. We respect your practice setting and the regulations you work under. Our goal is to discuss how to provide the best possible care, recognizing the unique contributions that each profession brings to patient care. I am honoring the land we are presenting on today. We respectively acknowledge that Nestle offices across Turtle Island are located on the traditional treaty and unceded territories of First Nations, Inuit, and Métis people. Indigenous people share a sacred relation with the land, and this acknowledgement is only the first step in learning more about our history and taking action towards reconciliation. I'd like to introduce our speakers for today. Natalie is a speech language pathologist with experience in assessing and providing interventions for communication and swallowing disorders across all age groups in community settings in Ontario. She has also taught in the Community Disorder Assistant Program at Durham College and was a placement supervisor for students. Currently, Natalie owns and operates a private practice offering speech, language, and swallowing services. Jan is a combined trained therapist, OT-PT, with over 30 years of experience in eating, drinking, and swallowing. She works at Access Community Therapist, providing dysphagia consultation services in BC. She is an associate clinical professor at the School of Occupational Science and Occupational Therapy and a member of the ITSE Board of Directors. Peter is a registered dietitian providing nutrition and dysphagia management consultation to individuals with developmental and learning disabilities living in community and home settings. He helped develop the Swallowing Intervention Service, an outpatient program supporting individuals with dysphagia for over 30 years. Peter is the international chairperson and CEO of the International Dysphagia Diet Standardization Initiative and also a clinical instructor at the University of British Columbia. We are very excited to have Natalie, Jan, and Peter leading this discussion today. Our financial support for this presentation was provided by Nestle Health Science. The views expressed herein are those of the presenters and not necessarily represent Nestle's views. The material herein is accurate as of the date it was presented and is for educational purposes only and is not intended to substitute for medical advice. So we'll now begin today's webinar with a poll question to find out who's in the audience for today's discussion. And I'll now turn it over to Natalie, Jan, and Peter.
Great, thank you, Erin. So we just wanted to welcome everybody to the webinar. We're excited to discuss and explore some of more approaches to team-based care, specifically in dysphagia care. So initially, we just wanted to get a sense of who's in the audience today. We have quite a few attendees. We wanted to open it up to see what everyone's background is. So we're hoping if you can answer in the poll, again, as Erin said, to the right of your screen, what profession you work in. So we have a sense of who's with us today. As you can see, our panel, we have 3 of the professions with us today, but we wanted to know who is in the crowd. So take a chance to fill that out. Okay, great. Thank you. So the poll is closed. So we have, just to kind of review, we have lots of registered dietitians with us, speech language pathologist, occupational therapist, some registered nurse, as well as physicians and nurse practitioners. And then there's some others as well, so that we weren't able, our poll didn't capture your profession, but we appreciate having a variety of individuals with us to explore this topic further. So our next poll question, I'll pass over to Jan.
Hi there, and let's just move to the next one. So the next question is, we want to know if you work as part of an interprofessional team for dysphagia assessment and management. And so we're really looking at is whether you do. Now this could be formal, informal, and I think we're really just trying to get a nice picture of what the different practices are, because there are often very many in there. So again, we'll give you a couple of minutes to do that and see what kind of a range of different options we have out there with this group. So remember to click on the right of the screen to answer the poll questions. And I'm not sure if we've got our results coming up here.
So Jan, I can see the results here if you want me to.
Sure. Yeah, I'm actually not seeing them, so
Yeah,
that'd be great. I think a couple of us aren't seeing the results.
Yeah, so I can see them here. So over half the respondents said that you are working closely with the healthcare professionals in an interprofessional team, which is great that that's we have lots that are working in that type of environment. And then C was the next most, about a third saying that occasionally collaborating with other professionals as part of that. And then some working more independently. So that's great that we have some people with some experience, and then again, hoping to kind of draw on some of our perspectives as well on how we can continue to promote that important need for interprofessional teamwork.
Great. Thank you, Natalie. We'll move on to Peter.
Great. Thank you very much. And we have a third question for everyone. And that is, which professionals are part of your dysphagia team in your workplace? This is one where you pick as many choices that are relevant to you. So please go ahead. Make sure you click on the poll on the right-hand side of your screen and answer the question. Thank you. For the audience, the silence must just be, horrifying, right? Whereas for the panelists, when we can see the poll results come in, it's almost like one of those horse racing games. It's like, ooh, who's ahead? Yeah. So happy to tell you, I think the polls are done. In this case, the audience answered about 35% registered dietitians, 25% speech language pathologists, about 18% occupational therapists, just over 10% registered nurse or nurse practitioners, or practical registered nurse, and then just under 10% physicians and nurse practitioners. And then about the 3% mark are others that we may not have identified here. And again, apologies that we couldn't list an exhaustive list. great results in just helping us to understand who people are working with. I think we'll start in by talking about team-based care, because that's what this webinar is all about. And what we'd like to do is really just sort of provide our perspectives initially on what we think team-based care is and what we've experienced as team-based care. So I'm going to hand it back over to Natalie first to just provide her perspective.
That's great. Thank you, Peter. Yes, and thank you everyone for participating in those polls to get a sense of kind of where we're coming from and where we're moving forward. And I think when we think about the term team-based care, what is a team and how we're providing that care? And I think, the team definitely involves the professionals, but also the client and their caregivers and their families as well as we're working on that team. And the idea of our client goals are our goals, and how that interplay of what it is that the client's goal is, how do the different professions with our different lenses, different perspectives come together to kind of collaborate rather than, more of that silo-based, I only do this. Initially it was like, well, I do from the neck up as a speech language pathologist, but really I also need to know, lung status from a swallowing side as well. So respiratory issues. So I think the idea with team-based is how do we work together as a team, bringing the different information, it's a snapshot in time. So being able to have that team collaboration right from the start, even a case history, being able to gather. Sometimes clients tell different professions different things. They think that's what's important to highlight with that. So then being able to pull that information together, doing an assessment, assessing different areas, different pieces across different time points even can be helpful as well. And then moving from assessment to intervention of how to actually implement an intervention plan. What does that look like for the client? What do they want to work on as a goal? I know even when I worked in a hospital setting versus community-based, those goals can really shift. So working together across the disciplines, and that interplay of, okay, if we're trying to work on this one area, how does that impact each other thing, kind of that domino effect. Okay, if they're having trouble with this, is that going to impact further? If the mobility issues, of where are we at with that? So definitely that idea of kind of team-based care across from intake, that referral, the case history through to assessment and treatment as well. So maybe
Jan, do you want to jump in here?
Sure. Yeah. Sure. I'll just add to thanks, Natalie. That I think was a wonderful sort of summary of kind of how that works. And I think a couple of things just maybe to add into the perspective, because I think I often see that sort of picture of what a team looks like, certainly obviously including all those participants, but there's often needs to be a certain level of flexibility and fluidity with it, depending a bit on your particular setting. Sometimes I know personally I've worked in much more formalized, very comprehensive team-based care in a much larger kind of urban setting, and then I work also in community where we kind of come together as a team in a little bit more informal way, in order to provide that care and to make sure that we're really all communicating well around the needs and communicating well with clients, caregivers, so that they're not getting confusing or conflicting information. And I also think I work out in rural communities where you don't always have every profession available to you, but you have multiple needs. And I know people are probably coming across Canada, which is an enormous country that is very spread out and with people living in all kinds of settings. So again, I think focusing our goal back on is how do we work these and sort of work together in a collaborative manner to actually meet the needs all the way across a whole spectrum of different kinds of settings. So I think I'll stop there and just pop it back to Peter.
Yeah, thanks, Jan. Thanks, Natalie. I think what I can contribute to this discussion is just the fact that I feel very privileged to have worked in many different settings and with many different professionals. And as Jan had mentioned, each team, the dynamics of the team will be quite different, and the members of the team will be quite different. I've just had this privilege of being able to support individuals with developmental disabilities, and sometimes they have dual diagnoses that actually require the support of a mental health team even. And sometimes we forget that there is another perspective other than just the medical side of the dysphagia. And I'm hoping that the audience is starting to get a picture of, our perspectives, which is be as comprehensive as we can. And at times we need to be creative about who we invite to provide input, who we involve at which point in the journey of supporting individuals. I think there's a danger in trying to define, as Jan said, in a concrete way, what that team is supposed to be. There may be a core team that is initially involved, but I think, in order for us to optimize support and care, we need to always be flexible and a lot of times think outside the box. Yeah.
Okay. Maybe I'll jump in on this because this is, I think, an important sort of a thing to think a little bit about. And I think a lot of these terms are confusing. So I'm kind of going to make a stab at putting this out there. And many of you who do have your colleges, obviously there will be certain things that are written up within your colleges that define what your scope of practice. So that is sort of your broad, what can you as a ex-professional what can you provide within your area of practice? What have you had the training, the knowledge, et cetera, to be able to provide? So that can be a broad range of different types of skills and experiences and so forth within any practice. It's not just one particular area. Versus, I think, something called role designation, which is often something that people's roles within a particular organization or particular job setting, some of those things tend to be defined, and those often are things that are done perhaps more in the actual setting, and depending a bit on the interactions and the other resources that you have available. And I think there are two important things. One of the things about scope of practice is, we all are able to practice as our particular background. I'm an occupational physiotherapist by training, and we also have to recognize that we have to be competent, and that is something you report to your colleges. You can practice with this within your scope, but you must also know and ethically bring forward it's within that to your college to state that you actually have the competence to be able to do those things. So I think those are sort of some important concepts, and I'm going to hand it over to Natalie and Peter to maybe talk a little bit more about some of the restricted or reserved kinds of things that come up in those. So
yeah, and I'll jump in from there. As Jan was mentioning about the scope of practice versus scope of competency, definitely kind of plays into what is your actual education training. Have you done additional training, mentorship for things? So for example, one of the restricted ones would be things like fiber optic endoscopic evaluations, where you're actually going past the nasal cavity. So if you haven't done that training and been formalized in that, it's within your scope for example, as a speech language pathologist, to do instrumental assessments, but I have never done a fees assessment before, so that wouldn't be within my scope of competency. So that is certainly an area where some people have been able to get that training and much more specialized in that to be able to conduct those instrumental assessments. Peter, from the dietitian lens.
Yeah, and Natalie, funny that you should mention, the level in which you can pass, some kind of a medical device. In the College of Dietitians, there are restricted activities on, especially in BC. I remember working on this particular one where we talked about the dietitian being able to pass a nasogastric tube, right? Because in a few practice settings, there were individuals who were well experienced and competent to pass a nasogastric tube with the order from a physician. Now, just because we can, initiate and put that tube beyond a certain part of the anatomy doesn't mean that we can now take over and do something else, like fiber endoscopic evaluations. We don't know how that might work, right? And so it's so important that when we are practicing, as Jan said, it's our scope of practice, it's our competence, okay? But there's also, sort of professional confidence that's required here. Just because we can do something or are allowed to do something doesn't mean we should. I can speak particularly from a dietitian perspective. The most, sort of prevalent thing that we see often is dietitians talk about, well, where do we get our training from when it comes to dysphagia management and, playing a role in the interprofessional team. And I always say, well, the best place to actually get some of this training is with your colleagues, your professional team. And I think, when we sort of talk about optimal communication and interprofessional collaboration, we'll dive into that a little longer. But I wonder, maybe we could just transition and start talking about some of the evidence that's been out there.
Yeah,
Okay.
Peter, can I just make a mention is just to the attendees that if you can please post your questions in the Q&A, we'll certainly be happy to try and address as many as we can at that time. And it's over on the right-hand side of your screens. Thank you. Sorry, Peter.
Oh, no worries. Thanks, Jan. Jan, Natalie, if you don't mind, I'll jump into this one first in terms of evidence-informed practice. I think we see a lot of publications around the benefits of interprofessional, multi-professional, and even now into disciplinary type practice, where we're exploring overlapping scopes and looking at how that can optimize care for patients. But we're also now seeing a trend the other way around, which is in areas of the world where there are more specific, scopes being identified by organizations to say, well, you are a speech language pathologist. This is what you do. You are a dietitian. This is what you do. And you are an occupational therapist, or you are a respiratory therapist, and this is what you do. And we will, I think, continue to see information like this coming up from different arenas internationally. And the question, I would ask is, because we're seeing this kind of an identification, does that mean that we need to now steer ourselves towards that direction when you've got a system that is currently working well and it's optimized to provide care? So I think I'm throwing that question out to the audience to consider, that we have both sides of publications and directions coming out. Jan, Natalie, I'm going to throw it over to you before I get on a soapbox with this topic.
Yeah. And I think, again, I think, when you're working in a team or you're working in this kind of a way, part of it is developing relationships, which we'll talk about a little bit further along, but also sort of a trust in each other and understanding there's ebb and flow within the system. I think we're all smart people, but we all had to learn certain things along the way, and we all can learn and continue to learn. I mean, that's a really important part of it. So I think, again, it goes back to, do you have the knowledge, skills, and experience in order to provide a task? So it's around your competence, which is a very important central piece of this. I also think, sometimes when systems become rigid, they really have great impact on different kinds of settings. As I mentioned, I work around our province of British Columbia, so I'm out in rural areas where you can't get, they haven't been able to fill positions with certain professions. They don't have that. So, from the client or the patient's perspective, here you are with all these problems and everybody's going, oh, sorry, we can't help you because we don't have this particular discipline. That isn't really helpful, especially when people can help. Again, you have to identify to what degree are you comfortable providing what level of service, and recognizing when you need to seek out extra resources or somebody with an additional level of skill or ability. And I think that's really an important thing to do is, recognizing what you can do and what you're competent at, but also recognizing when you need to seek out. There's always people who have more to share with us. And I think that's just an important thing to keep in mind. But I also really dislike sort of seeing a rigidity coming into a system, because I think it really begins to impact on care for the very people that we're all striving to provide good care for. So Natalie, I'll pass it along to you.
Absolutely. And as Jan was saying about that idea of seeking out others with experience, you think about, we definitely have our research evidence going back to that triangle we always look at, and then that clinical experience too. So who has the experience clinical? What is the research saying? What are we seeing clinically? And then that patient and client piece as well. So bringing all three of those elements in to, as Jan was saying, and Peter, to really provide the best patient care. That is what our outcomes are looking for, is the patient care. What are they receiving? And by having some of that flexibility in terms of who's providing what's being provided, and to be able to address those goals and those needs across different settings as well. So I think talking about settings, that kind of leads us into our next poll question here, is what does a team-based approach, those that are working in a team-based approach, look like in your workplace? Because there's definitely lots of variability as we're working towards more team-based in terms of what does that actually look like. So you can see the poll questions there looking at, is it more collaborative? Is it team meetings, sharing it, or is it coordinated care, or is it something else entirely? As we talked about, thinking outside the box, it'd be great to have, if anyone has anything they can post in the Q&A. If you're one of the other ones that we weren't able to capture it, what does the team-based approach look like in your work setting? Okay, I think our results are in, and it's looking split across some of the areas. So about a third having that coordinated care and communication between the different health professionals, just under a third that collaborative assessment management, about 22% sharing that expertise between those team members, and then the last 16% regular team meetings, and then some that have selected other as well. So we'd be happy to hear kind of what your other is as well. So that's great to see some different approaches, and that's definitely an area of continuing discussion in terms of how to optimize that professional collaboration, which kind of leads to our next point here is, so I guess I'll just continue on and then I'll pass it over. But in terms of what does that look like in terms of how to optimize that collaboration, we all come with our different backgrounds in terms of our education, our clinical placements, our experiences. So we have different perspectives, different priorities for that. And that really comes into helping meet what are the client's priorities, in terms of, for example, what they want to eat, how they want to eat, where they want to eat, and then all of those different roles. So for example, being able to have that connection. So if it's something, oral care, do we need to have some other professions in there, dentist, denturist coming in, in terms of how they want to eat, they want to be able to still feed themselves. Well, do we need to look at adapted cutlery, some positioning, where they want to be able to go to a restaurant. Okay, how do we set them up to be able to find out if the restaurant can provide a modified texture, things like that. So being able to have that collaboration across the lifespan, and even across the client's needs. So palliative care is another area I've done a lot of collaboration in. When a client is in palliative care, how are we providing that support? I think too, with dysphagia being such a eating and drinking is such a human thing. It's a social piece. For that, it can be a cultural thing as well. That we eat our 3+ meals a day snacks, that it really is that such an important integral part of kind of who we are, who a family is. What does eating look like in your home? So being able to kind of bring in different professionals, different perspectives to make that eating still enjoyable, or is it things like being able to still provide good mouth care, to make that good oral care or comfort care, feeding and as well. And it's one of those things that really can impact a person's quality of life as well. So I think being able to have those different professionals to maximize individuals' quality of life. Jan or Peter?
Sure, I'll jump in here. Natalie, thanks for talking about quality of life, because I think that was something that reminded me to really address the whole issue of the client, the patient being the center of the focus here. I think that is often what helps us to refocus how we can work best interprofessionally. So often I've worked in environments, and I'm not happy to say, where people want to come in and look like rock stars, right? They want to be the savior, right? The person who comes up with that magic intervention. And sometimes it's because, they're driven to do so, to try to prove their worth for budgeting purposes, right? I managed to save X number of people, therefore my budget line should be kept when budget is an issue. Sometimes it's because, there's just more services available. So, a certain profession would have more time to spend. Regardless of what that is, I think as a professional, we owe it to our patient, to our client, to start thinking about what's best for them and not what's best for us. And it sounds like a broken record, because I think I've said this a million times in different presentations and workshops with people. Optimal interprofessional collaboration, if we can focus on to the person that we're supporting, okay, and make sure that we come from a wonderful place, a generous place, then inevitably, I think we will optimize care. Jan, over to you.
Yeah, thanks. And I absolutely, I think as an OT, client-centered care has been part of sort of where we came from in terms of looking across at all of those things. And I think too, one of the really important things, because I've seen and had the privilege of working on very just really dynamic, high functioning teams that really sort of work together with families, family, client, patient, in a very a very collaborative way, and honoring those decisions, choices, and so forth. And then I've also watched things really fall apart when people are, as you say, Peter, sort of focusing more on the importance of their needing to maintain their role and stuff. And it's quite distressing to see things change in that way, rather than, trying to see the value. And I think that's where it comes down to. If you're going to be part of a team, you have to really understand and support and see the value of interprofessional work and going in that direction. I'd also like to just comment that I think interprofessional, the value is seen certainly in the academic world, in the sense of there's a lot of interprofessional activities for students who are learning to come into our professions. The universities are trying to support and find opportunities to have these kinds of things happen. Peter and I have both been very involved with a number of activities through our university connections in that way. And to me, it's problematic when students hear this and come out and are looking for this, and then they're not seeing it out in clinical practice. And I think it really, if you're out there doing clinical practice, and I think it's really important to think about how you're portraying or how you're working within that, and are you in fact, what kind of a picture is this painting for students and young new people coming into the professions. So I think those are really important kinds of things for us to always keep in mind around that. So valuing interprofessional collaboration, is that something you truly value and you truly believe in? Because I think that goes a long way of helping you build on that with your team, and having your team move in that kind of direction. So I don't know, are we still good to go, Erin? Or looks like we've got a new heading. This is our guide to move ourselves along here. So Natalie, why don't I pass it all over to you, and if you wanted to talk a little bit about the next topic area.
Yes, I think definitely communication. I'm from my SLP hat as a huge piece, but that idea of you said about, it's one thing to have that as a value, like if you value having that interprofessional care, but how do I do that? Where do we go? And whenever I attend a webinar, what am I taking away from this? What am I how am I going to apply that? So I'm hoping this last part here, people will really be able to kind of take something away with you after today's webinar. That I think the idea of, well, how do we build those relationships within the different professions, and also with the clients and the families themselves and the caregivers, and talking about how to communicate and what it is that we're doing. Because sometimes, clients come in and they're seeing so many different professionals, like which one are you? And even in the term speech language pathologist is often a bit of a misnomer for clients, in the sense they're like, I'm talking fine. I'm like, oh no, it's for your swallowing. Same muscles to eat that we use to talk as well. So even not just that piece of educating, kind of why you're there, what you're doing, but also that in terms of when we think about when we are presenting information to clients, oftentimes we're presenting information when they're under some type of stress, whether that's they've just been admitted to hospital, or they've just been discharged home, or they've received a new diagnosis. So we're trying to give them information, and oftentimes that's being missed. So done a lot of research and looking into health literacy, so people's ability to actually understand what information is being presented to them from an assessment, a diagnosis, treatment plan, and people's health literacy can often be quite low, and that's at a baseline, let alone when you're upset, finding out, or you're under stress, or there's a lot going on, a lot of family dynamics, lots of times of transition. Oftentimes when we're getting referrals, when clients are transitioning into hospital, out of hospital, into long-term care, things like that. So I think it's important too that the communication, that we can all be communicating, repeating, rephrasing information too, because clients may have missed information. I had one client, for example, that was sent home. They thought they could only have thickened water, like water, and that was it. So you can imagine, like they've been going, a week, just water, nothing else. They didn't realize, because again, that miscommunication, that they could put the thickener in anything. So sometimes too that, we think about what is our role, but it's also part of that to be able to reiterate what other professionals have said and how that impacts pieces as well, and reviewing what have you been told for that. So doing things such as, having things in writing. I always, for example, would leave a written swallowing recommendations form, so that, and then others could add their pieces into it. Medications, it's one thing I say, crush the meds, but if we find out from the pharmacist this one can't be crushed, being able to have that consistent communication, that we can review, okay, what did they actually say, versus sometimes clients' interpretations of things can be different too. So wanting to have that consistent communication across different professionals, and again, that it's okay to repeat information to clients so that they have a better understanding of what it is that we're trying to communicate. We all have our own lingo, professional lingo and things, but then trying to make that very client-centered, client-friendly. And from an SLP side, working with a lot of clients that have communication difficulties and challenges as well. So trying to build that piece so that they understand what's being said to them, and then what each profession, and then connecting with those different professionals. Okay, what are you seeing? What's happening? So that everyone's on a united front to provide the best care for clients.
Okay, maybe I'll. Thanks, Natalie. That's great, and I think I'd echo all of those kinds of things in terms of that. And I think one of the things with the communication is also thinking of it across, not only within your own sort of area of where you work, whether it be acute care or so forth, but also the importance of, again, obviously with families and client patient consents, but ensuring that the communication as it goes out and feeds back into the living situations of those individuals, so that you do have good two-way communication. I've worked in acute settings where I'm kind of working on a specialized team, and I also work in community-based settings where I am, and I maybe that there are in the individuals I'm working with flow back and forth in between that. And I think one thing I really value is when I get information back from somebody, and I can share information about what's the context of this person, what's the reality of their living situation. Sometimes when they're sick or they're in a sort of an acute or a different kind of context, what you see there may not be, and the recommendations may not be that realistic. And also, as Natalie pointed out, is interpreting that information back. So really having good, strong communication back and forth around those things is I think extremely essential, and valuing the information that you're getting, not just assuming, oh, well, this is coming from there or that person or that profession, therefore, I don't need to sort of pay that much attention to that, because I think we all bring something to the table, and this is very essential in terms of if we're keeping our goal on that client, that patient, and what's sort of going to provide the best support and assistance for them as they move on in their world. And so I think that's a really important context, because there's the medical side of things, but then there's life, and we need to remember eating is part of life, and that's sort of what the interest of our the people that we're working with is about, getting on with life, not sort of looking at it from that sort of medical perspective. So I'm going to let Peter have a little bit of time here to kind of
thanks, Jan.
finish things off.
Yeah. I joke about this with students at the university, because I always say, we're dietitians. We always want people to eat. And then, I take this to the next step and I say to them, well, but have to remember that breathing is actually more important than eating, right? And so I think, I want to launch into just a different aspect of communication and relationship building, more on a professional side. We have to be careful about making assumptions. And I know you hear this all the time with communication workshops, but we have a tendency as professionals to make assumptions about the roles and scopes of other professions. Okay, and maybe we were trained in a setting where, you've been exposed to a certain hierarchy of, okay, well, when the doctor says this, we jump and we do this. Or, well, when the speech pathologist says this, that must be the source of truth, and this is what we do. Now we, talk about this one example, which is so often you may see, okay, well, because of challenges with handling bolus volumes, maybe that recommendation is, use a teaspoon to eat. Well, I don't know how many people on this webinar have actually eaten only with a teaspoon, right? And if your role, in the care of this individual is nutrition management, then we need to jump in and say, hang on a second, no matter how calorie dense we're making something, using that teaspoon is an impact on the quality of life. Okay. And rather than, I think, overriding that somebody else has recommended, this is where it's very important to have that communication. And that communication can only be optimized if there's a relationship that is trusting, okay, that, you know, has that ability to allow each professional to express not only their thoughts, but the rationale. I think so often, you know, we might see a set of recommendations, but we may not see the why behind all of that. And it's so important that when we are wanting to provide optimal support, to be able to find out the why. And I'm hoping the audience here today will be challenged to think about that moving forward. Don't only slap some recommendations on your charts, on your handouts, okay? But it's so important to actually explain the why, not only to paraprofessionals, but also to our patients, right? Because so often, you know, when we hear the patient say, well, yeah, but so-and-so told me I need to do this. And Natalie, thanks for clarifying that, you know, literacy is often a challenge and people may not understand, they may not have that medical background. And so let's be grounded, let's come back to earth. Let's talk about life in real life. So we're hoping that, you know, you have taken something away from this webinar and this conversation. For those of you who may have come onto this webinar hoping that, you know, Jan, Natalie, and I would, you know, help delineate and help you draw lines in the sand, well, we're so sorry to disappoint you, because we shouldn't be drawing lines in the sand. Okay? In fact, we should be actually putting out those lines in the sand and all play really nicely in the sandbox together. Okay, so ultimately, it comes back to the patient. And we hope that that's what this webinar has helped to do, is to just challenge your perspective. Yeah. I think, Erin, are we going to share some references?
Yeah, I'll just comment. So we've just pulled together a few different kind of references that you guys might be interested in. Some of them relate, many of them relate to interprofessional practice, and some of the sort of different information coming from a variety of bodies, including the Canadian Interprofessional Health Collaboration, and that's the College of Health Disciplines. And these are, you know, these are bodies that are really working towards looking at interprofessional practice. So I won't go through them. The information is sort of listed on the webinar slides. And I think there is an evaluation, but maybe Erin, you're going to talk a little bit about that. So I'll pass it over to you.
Yeah, thank you. Thank you for the presentation today. We do have some time for some questions, and there's lots of questions in the Q&A box. So there is a box to the right of your screen that you can add your questions into, and we'll try to get to as many as we can today. Okay, we'll start this off. So the first question is, how should or can dentists, I think I just pushed it to the screen for you guys to see, actually. Sorry. If you can read it off.
Okay.
And
yeah, I'm happy to jump in to this one. If you are not aware, in Japan, dentists actually play a really integral role in dysphagia assessment. Okay, and in fact, they are a huge portion of the membership of the Japanese Society of Dysphagia Rehabilitation. A lot of great research comes out of Japan with regards to oral care, oral hygiene. Okay, and in fact, I think some of you probably are aware that there was a study done where there was this very sort of luxurious intervention where dental hygienists went to this long-term care home and cleaned the teeth of the residents weekly. Okay, and what they saw was a significant improvement on any consequences from swallowing challenges. Okay, so we do see a lot of literature come out about the importance of oral care, okay, because we know that, pathogenic bacteria that exist in our mouth, when those invade the airway, they cause way more consequences, okay, than anything that we can eat and drink. So, Natalie, feel free to jump in.
Yeah.
I think, oh.
Go ahead, Natalie, and then I'll
Yeah.
comment. Yeah.
I think because like oral care is definitely a huge, one of those pillars we talk about for that, and being able to sometimes to the dentist, dental hygienist in terms of that training piece too for clients that are maybe dependent for their oral care. That as a whole, that's one thing to have poor oral hygiene, but now you're dependent for that as well. So that really adds another layer too. So to be able to get some of their strategies and recommendations of how to best clean an individual's mouth that needs that assistance from someone else is really important, as well as I guess tagging on to dentist. Denturist is another profession I've often collaborated, because some of my clients, if their dentures are ill-fitting and they're eating with them in, they may not have a swallow. The swallowing, we think there's 3 stages: your oral in your mouth, and then your pharynx. That first stage, sometimes it's more of an oral dysphagia rather than they can physically get it down. It's just that if their teeth are not fitting, or they're missing a bunch of teeth, or things that may be more. If we can get that, okay, they can swallow it down. It's just getting it masticated in that first stage.
Yeah, we joke about the fact that the dentures, when they're loose, actually presents a mixed texture in your mouth, right? So, Yeah, sorry, Jan, over to you.
Absolutely. I think it's really essential, and I think also for for dentists and dental hygienists to be aware when somebody's experiencing some difficulties with swallowing. I know when I'm in there with my mouth open and all that saliva is pooling and I'm madly trying to swallow, how difficult that is for me in the dental chair. So I think certainly being aware when somebody does, looking at how to position them rather than always reclined, how can you comfortably sort of approach this with this person in terms of positioning, and then some of that communication back and forth. That the other thing that I comes up certainly within our client population, Peter and I both work with a similar population, is post dental surgeries and some of the issues that happens for our clients, because if they have a lot of bleeding, we have definitely had people post dental procedures end up with bad aspirations and so forth. So I think it's critically important to be part of that picture and understanding, and then making sure families and caregivers really understand how you got to be more diligent, or you've got to be more careful around this, or how are we going to manage this in a way that this person is going to be safe as they recover from having this procedure done. So critically important. We love our dental hygienists that we get. We are so privileged to work with, and we're so appreciative of the dentists that are certainly working with we have a client population that has some specific needs, but they're a big part of our sort of team in that respect.
Yeah, for sure. And I'm going to jump in and say a shout out to our dental hygienists, because they are, I think some of them are actually on this webinar today. And it's like one of those Oscar moments where we say, oh, thank you, and forget somebody. We cannot forget our dental hygienists. If you do not have a relationship with a dental hygienist or a dentist, by all means, try to establish that relationship. It's critical. It really is critical. Yeah.
Perfect. Okay, thank you. I'll go on to the next question. There were several questions I'm going to kind of amalgamate together. As RDs in long-term care or working in community, especially in rural areas of Canada, we're often the person who does the swallowing assessments, as it can be challenging to get SLPs in, and also access to OTs and PTs. Do you feel universities need to do a better job at preparing RDs for this role, or is it a matter of getting better, how can we get better access to SLPs, OTs, PTs?
Well, because it's an RD question, I guess I should jump in first. I think what we can say is at the University of British Columbia, and I can only speak for the University of British Columbia, we're trying, we really are trying to prepare graduating dietitians to be as prepared as possible, because many new graduates do end up working in long-term care and long-term care settings in very remote areas. So inevitably ending up being the sole person that is overseeing eating and swallowing challenges. You know, again, it's one of those, well, who is in the local community, who can be your support, rather than feeling isolated. You know, it sounds so old-fashioned to me to say, but pick up the phone, dial the local hospital, okay? Dial a community nearby, and to see if there's some kind of support that you can get if you're feeling, you know, not confident about what you're doing. But Jan was also mentioning about the University of British Columbia international interprofessional education. There's an interprofessional education group working on how do we now help you know, every profession that supports somebody in eating and swallowing become better connected. And I think that's what we need to do, not only in BC, but all across the country. You know, let's break down those bloody walls. I'm sorry. It's time we really have good conversations with each other, you know, gain that trust all over again, rather than be fighting about who is supposed to be, you know, the key person involved here, right? Yeah.
Yeah, I was also going to say, I think, you know, much as we all like to forget about COVID, I think COVID, the one, if you can look at one positive thing that came out of COVID, was I think it opened up a lot more opportunity and understanding about the use of virtual or remote types of support services. And I think it would be nice to, you know, have more push on some of those additional supports, you know, to be available. So in some ways, like seeking those out, you are not going to be able to find every profession in every single place. And people, you know, there's life, people have babies and move, and partners have jobs elsewhere. So that happens always around rural and smaller locations, and funding is always going to be a challenge. We're never going to really solve that to have what we'd love to have. So are there some ways, perhaps using virtual, you know, support systems that could provide some of those kinds of things? Some in BC, we do outreaches. I'm pretty sure that probably happens in other provinces where some teams go up. I do some of that work myself. I fly around to little places in the province and you know, provide some of that and work together with the local teams here, so that hopefully as we work together, certainly everybody's knowledge goes up, and then you build the knowledge and the capacity within your community. And those are some of the models that I think might be helpful to think about, and whether those are things that could be explored or looked into to try and improve your capacity and your competence and comfort.
Okay, thank you. I have another question. Is there any research or publications which have explored qualitative data on patient experience with interprofessional dysphagia care teams? Not to put you on the spot.
I know there was one, I mean, I'm not sure. It's a good question. It's a good question. You know, we probably all have to go and do a little lit search ourselves to hunt that down and look to see, you know, what that is, or the feedback. I know, just in terms of just sort of more, you know, and you know, just from experience with patient or individual feedback from sort of two our teams from surveys, generally there's been fairly positive feedback of it's nice to have everybody in the same room and be able to ask all your questions and not have to sort of repeat everything over and over again in a sort of siloed way. So that would be just sort of some general feedback that we, when I worked on some more formalized types of teams, that we would hear back from patients and families is they appreciate people being in the same room and being able to ask their questions to a group and having things clarified and sort of sorted out in that way. But yeah, it's a great question. If not, if you'd like to do a research project, that would be fantastic to the person who wrote the question.
I just going to say, I think we have a study. Yeah, we just identified a need, I think. There's another really good question. It's about how do you even start the conversation with other professionals about collaboration, like when you typically are working in silos like right now? So how do you bring that conversation forward? Do you have any tips or strategies that you could provide?
I think from my perspective, sometimes it's one thing we often come with problems, but the idea of coming with a problem and a solution can be helpful too, rather than just saying this is all the issues. How can we address that and connect that? So, kind of saying here's what I'm seeing. What are you seeing? And then rather than, feeling like you're all of the things, kind of bringing, okay, this is what I've seen with the client. What do you see as well? And I said before about that snapshot of when we see clients for their sessions or their assessments, being able to connect with others, what's happening in your set. What did the client said to you about what do they want to work on? What is their goals? Because sometimes too, they, again, often disclose different things to different people or feel they have more time to talk to different professionals about things. So again, talking to those professionals, this is what I'm seeing so-and-so patient. This is what they've expressed to me. And starting it that way. And again, coming with a solution of, okay, they're having trouble with this. Here's my idea. Do you have any suggestions for this? Rather than just saying, here's the problem and the issue, coming with that solution piece as well.
Yeah, I think Natalie, it's partly that relationship building, and listening and sort of approaching it in a way so it doesn't feel like, oh, how come you want to do this? But again, it often starts with trying to just build relationships and have conversations with people and get a bit of a feel for where things are at. So I think as you build the relationship and then contribute to, as Natalie says, here's what I've been noticing, or geez, I'm wondering how this might impact. Can we talk about it? And sort of starting in that informal way sometimes is how it is. I mean, I often am doing a lot of informal team pulling together. That's sort of how Peter and I work in the community. We're coming from different places, but we actually have gotten to the place where we do a lot of joint things together so that it's very easy for the patient or the caregivers to understand, we're on the same page, here's what we're saying, and they're not getting confusing sort of information. So I think those are sort of ways. And I think the other thing is really focusing it in always on the goal of doing the best work that you can and working in a way that's of most benefit to that individual, that client, that patient. Because I think when you keep the focus on that and not on jobs and roles, that you're able to actually move further forward with sort of getting to that place.
Yeah, Jen, I was just going to say, be human. Just think about, relationships outside of the professional realm. If you are, trying to establish a romantic relationship with someone, you don't immediately launch into the rules of engagement 3 minutes after you start having coffee, right? You learn about each other, you establish that kind of relationship, and, bring all those skills into the professional circles, right? Allow people to see that you do come from a place of care. You are a human being, but also be open and receptive enough to see that the other person is a human being, okay? Because the moment that we put each other on the defense, then that, really challenges that relationship building, So yeah, take the initiative, make a friend, make a new friend. Yeah.
Perfect. Thank you. I'm apologize. We have lots of questions in the Q&A, but unfortunately we've run out of time today. I would like to thank Natalie, Peter, and Jan for sharing with us this insightful information today. It's been a great discussion. I feel like we could have part 2 of this webinar as well. Really, our discussions today emphasize the importance of respecting the regulations set up by every college in every province. And we value and respect your practice setting and the regulations you do work in. The goal of this discussion today has been to explore how we can collaboratively provide the best possible care and acknowledging and appreciating the unique contributions that each profession brings to patient care. Thank you for your comments and your questions today and for your time. We'd appreciate your feedback. And if you could please take a few minutes to answer a survey. To the left of your screen, there is a forms option. Please click on it and complete the feedback survey. And once the recording is ready, you will receive an email that will include a link to today's recording of the webinar and also your certificate of attendance. And yeah, and I appreciate everyone's time. So we're going to end our webinar today, and I hope everyone enjoys the rest of their day. And thank you for participating today. And